Did you know obsessive compulsive disorder varies across cultures? OCD is a psychological disorder that is often misunderstood by the general public. If you've ever heard someone say, "I'm so OCD," they probably are just talking about being a perfectionist or liking to keep things clean and organized. That's not OCD. OCD is when a person has intrusive thoughts that they obsess over, and then they have to do an action or compulsion to relieve it. These obsession and compulsions could be about anything, from having to wash your hands until they are raw and bleeding because you're afraid of germ contamination or diseases, to asking your partner to repeat positive affirmations while repeating a task because someone on TV mentioned cancer, and if you dry the dish now, you and your partner will both get cancer. If that sounds weirdly specific, it's because my boyfriend has OCD, and I'm recalling an experience that we've had many times over. After being with the same partner for over 6 years, I've gotten very familiar with his OCD and how it affects his life. But everyone's experience is different, and everyone has different ways that their OCD is expressed, and that actually varies across cultures. According to Frontiers in Psychiatry, a journal article titled Variations in Obsessive Compulsive Disorder Symptomology Across Cultural Dimensions, Middle Eastern cultures are significantly more likely to have religious compulsions. On the other hand, South American cultures have a higher frequency of aggressive or violent obsessions. This is likely linked to higher crime rates in that area. Western cultures often have more common checking and counting behaviors. The culture of India focuses on contamination and cleaning compulsions. East Asian cultures often focus on symmetry and order. And in African cultures, there's a prevalence of superstitious compulsions. These differences are likely linked to whatever a culture is more exposed to. According to Cross-Cultural Phenomenology of Obsessive-Compulsive Disorder in the Wiley Handbook of Obsessive-Compulsive Disorders, OCD even has a link to gender roles. Women with OCD have a higher focus on cleanliness and domestic duties, while men may focus on social status and control. An article from the Pakistan Journal of Psychological Research titled OCD in a Cultural Context, a Phenomenological Approach, concluded that while the core OCD themes are universal, the experience and expression of symptoms are linked to cultural and linguistic context. For example, some of the most prevalent obsessions reported are repetitive negative thoughts, fear of developing a mental or physical illness, and fear of germs. And then some of the most prevalent compulsions are hand washing, slowness, counting, and checking. But the extent to which an individual displays these compulsions or obsessions depends on the cultural context. According to OCD in ethnic minorities, which studied the differences between minorities and non-minorities and the OCD they displayed rather than specific cultures, they found that minorities were 1.74 times more likely to endorse the magical or superstitious category of OCD symptoms compared to non-minorities. Another important thing to know about OCD and differences across culture is the way that OCD is perceived and treated. Since OCD is still widely misunderstood and unrecognized by the general public, it's difficult sometimes for people to get the help they need when they need it. Symptoms usually start presenting themselves in adolescence, so it's important for parents to be able to recognize those symptoms and get the child the help they need as soon as possible. The article Variations in Obsessive-Compulsive Disorder Symptomology Across Cultural Dimensions found that treatment of OCD is significantly more likely to have success if treatment is started during adolescence. According to OCD in ethnic minorities, minorities are significantly undertreated and underserved in both psychological and psychiatric services, which includes OCD. Some of these disparities in treatment are driven by financial and language barriers, or lack of proximity to clinics, but there's also a stigma around receiving help, which is even higher in minority groups. This journal also found that some minority groups, particularly African Americans, are more likely to try religious coping methods like utilizing the church rather than reaching out to a professional mental health provider. It's very important that we spread more awareness about what OCD is and how we can treat it so that people know that they can always get help and have access to that help. Cross-cultural phenomenology of obsessive-compulsive disorder in the Wiley Handbook of Obsessive-Compulsive Disorders found that clinicians often misidentify OCD symptoms when they don't account for a patient's specific sociocultural or religious context. Common misdiagnoses are anxiety, depression, and schizophrenia. This journal also pointed out that effective treatment can be tailored to the patient. For example, they found that repetition of a prayer, rather than asking for a religious patient to stop praying entirely, is more effective as it respects the need for religious activities such as prayer, while reducing the actual compulsion like repetitiveness. This idea of integrating religious literacy into therapy is known as religion-adapted CBT, and it has been found to be just as effective as the standard cognitive behavioral therapy. The article Variations in Obsessive-Compulsive Disorder Symptomology Across Cultural Dimensions points out that social acceptance is a big part. In some cultures, repetitive religious rituals are viewed as signs of devotion, which can lead to a positive social response that unintentionally masks the OCD symptoms. They also found that cultural background influences how the patients manage the unwanted thoughts. For example, Turkish patients are more likely to use thought suppression, whereas Canadian patients often use self-punishment. Overall, there's a lot of differences in how each culture presents symptoms of OCD, treats OCD, and even accepts or rejects OCD symptoms. So it's important for mental health professionals to know the cultural context of their patients and be able to communicate effectively and consciously with that in mind.